Right. So I'm just reading the questions here. Especially to which patient would you use the Rayface? As I mentioned, uh, to summarize, it's any patient or any treatment that involves a smile, whether it's a single crown, a bridge, a full mouth rehab, a set of veneers, all on X, full arch implant work is critical with face scanning, because with your full arch restorations, you can make them almost any dimension, especially buccally. So all of these factors are cases where I would use Rayface. Now we have another question. Is it possible to scan with intraoral scans a full arch case, a full arch implant case, scan the abutments on site, then face scan with the same scan abutments? Can they match it properly? Yes, you can. I kind of understand what you're trying to do. And I think you're trying to use the Rayface as some sort of verification jig, maybe. To answer your question, with the face scan, as long as you have enough data that can be basically joined with your intraoral scan, the technician should be able to join it together. My only hesitation with what you're asking about scanning abutments and then taking a face scan is that typically that's not quite enough data. It would be a bit tricky. You probably could still do it, especially if your edentulous and soft tissue scan is good, but you would need to make sure that your abutments are visible in the smile. If the abutments are not visible because you might have done it all on 4 and the implants are around the premolars or canine region, then it's less likely to be able to match accurately. But as long as you have some reference data between your intraoral scan and your face scan, it will be able to be matched. The other question here is, I want to avoid occlusal plane inclination during designing. Will it improve my outcomes? Yes, 100% yes. With face scanning technology, if you want to reduce occlusal plane inclinations, and I would either assume you mean buccal inclinations or cants, with face scanning technology, this is the whole point of it and why we use it. Because you can literally look at the case in 3D with the patient's face. So you can check it from the lateral profile to make sure that buccopalatally that they look okay, or buccolingually. And you can also check it front on to make sure there's no occlusal cants. Are you using Ray Teams as the fourth question? Yes, but sporadically. My lab is here right next to me, so I typically just transfer the files through our network. But sporadically, if I'm using or form of dialogue or communication with other labs, I will be using Ray Teams to send the data. And that's basically the last questions. We have one more question about how to add labs to Teams. And I assume if you're already a lab, I would reach out to the team at Ray, and they will help you make an account and set yourself up in Ray Teams. If you already have the Rayface software and you actually just want to add a lab to communicate with, then you go through the Ray Teams interface, and it's very straightforward. There's a plus button. You click add lab. You can see the whole list of labs, and you can just click to establish that connection. The lab on the other side has to confirm, and the connection is established. So that is basically all the questions. The other thing, guys, is that anyone who's on Facebook, I highly recommend that you join the Ray Smile Nation Facebook group. It's basically a user group of a bunch of Rayface users, and it's a really good place if you're seeking questions and you just want answers. A lot of the team from Ray in Seoul in Korea are on that Facebook group, so you can communicate with the team themselves. And it's just generally a great place for all of us to be sharing cases and communicate with each other. So once again, I thank everyone for joining us today. If you have any other questions, or you may be watching this as it's broadcasted later on, please just send it to the Ray team and I'll be happy to answer any questions. Thanks everyone for tuning in, and I'll see you guys around. See you later.